Now let's transition to stage 3 disease. Many of us on this panel have extensive experience in stage 3 disease. And before we start and talk about what I think is probably one of the more exciting phase 3 results in the past several years, the Pacific trial, I wanted kind of Dr. Langer to kind of level set us and, pre-Pacific, just your standard of care, what you did in your practice, what you think is acceptable in practice, and those sorts of issues.
So I think we've all come to accept, certainly in good performance status patients, those with lack of significant comorbidity or recent weight loss, that combined modality, specifically concurrent chemoradiation, is the standard of care. Over the past 25 years, there have been at least 10 separate prospective clinical trials that have shown that chemo added to radiation, whether it's induction, concurrent, is better than radiation alone. And of 4 trials that directly compared sequential or asynchronous chemoradiation to concurrent, 3 of the 4 showed a clear benefit for concurrent. And that, of course, is confirmed in meta-analysis by Oprah and others. But in the last 10 to 15 years, we sort of stagnated. Yeah. There were attempts to look at higher doses of radiation, marginally higher, 20–25%. 0617, appallingly negative. The higher dose arm actually had inferior outcome compared to the low dose arm. There were attempts to graft on not immunotherapy, but monoclonal antibodies targeting EGFR, cetuximab, at least no detriment, but certainly no advantage. We did not move the needle one bit. Attempts at looking at consolidation, non-cross-resistant chemo or the same chemo after the completion of chemoradiation, and at least those trials that formally compared that approach, docetaxel versus observation, again, completely negative. And in truth, the regimen that I have typically used, PAC-carbo weekly with RT, followed by 2 cycles of PAC-carbo, we never proved that those 2 cycles are actually better than observation.
Either before or after?
Certainly before we proved that they weren't, but after we never even addressed the question.
I don't want to get into that debate, okay?
So the standard, I think we don't...
And don't forget about that important gefitinib.
Oh boy.
I was waiting for you to say it.
I was being kind.
Thank you so much, Mark. He was being kind.
That is another example of a trial that not only failed to show an advantage, but surprisingly actually showed a detriment that frankly none of us anticipated. Yeah. I was on the data safety monitoring committee for that trial, and first they were unlabeled, and I thought, holy cow, gefitinib showing advantage. And then the head of the statistics department at SWOG actually labeled those curves, and lo and behold, I was shocked. So folks like me had a lot of skepticism about any new approaches here.